what we've seen is escalating inequalities, things like healthy life expectancy going in the wrong direction, and the gap between the richest and the poorest in our society have become more divided. And within that, we know that we have to do more faster for those that need more help. And we need to think about things that are impacting on people's health. So the things that can be prevented should be prevented. So the people that are dying early from cardiovascular disease, incidents around type 2 diabetes, people that are living in poverty that shouldn't be living in poverty, people living in homes that aren't warm and dry, which is leading to an increase in respiratory illness. These whole range of issues were issues that Michael Marmot set out in Fairer Society, and the things that we are obligated as a public sector to do more about. When we think about people's lives, I think about it in a quadrant. I think about their social, environmental, cultural and economic well-being. So when we bring those things together, we know that we have a growing population, an ageing population, against the backdrop of reducing resources. And therefore, those two things don't add up. So we need to think about how we do things differently to make sure that we've got the right advice and information at the right time for people to access support earlier, rather than just meeting the demand needs of people when they're at the worst part of that demand scale. So if we can get to people earlier, supporting them in the place where they are, instead of bringing them into acute services later on in that pathway, I think we will see very different outcomes for each other. And I think that is the absolute obligation that we have to do that, to change the way that we provide services, to make sure that people have access to the right information at the right time and getting the service from the right place, rather than just the place where they think that they can access. We know that we see people accessing social care at a point, whereas if we got to them earlier, we'd be able to put in a different level of support that could have been at a community level rather than an acute level. And that would be a very different change for that individual. The work that's taking place in Torfaen and Blaenau is transformative. What it does, it changes the conversation. What it's saying to people is that our public services, and in particular our local authorities and our local councils, are our first line of defence for our communities. And what this enables us to do is actually go into our communities, work with our communities and think about the strengths that people have within our local places, so our local assets, and build on those to transform the population's health. So this is about well-being, this is about education, it's about our foundation economy, it's about homes, access to green spaces, but most importantly it's about connectedness and about our services and our people working hand in glove with each other, that they're not separate. It's not a service providing to another, it's about how we can shape a conversation around the needs of our population and really transform services in the context of the way people live their lives, not in the way that we wish to provide services. The ingredients for good health are complex. I think a lot of people assume straight away it happens in doctor's surgeries and hospital waiting rooms, and it's far more complex than that. About half of our health is determined by the environment in which we live in, the jobs that we do, the education we've received, the homes in which we live. Another 30 to 40% will be around things in terms of the way we live our lives. So how much exercise do we get? Do we smoke or not? How much alcohol do we consume? The size of our genes, all kinds of things like that, what we eat, what we drink, all kinds of things. So only about 20% of our health is determined by how we access health services. So I think there is something about how we discuss this without creating judgment or blame. When we get into that behaviour bit, when we're talking about smoking and eating and exercise, that comes with a layer of judgment, and this is where we lose our communities and the conversation closes down, because not everybody has choice. I've actually banned the term lifestyle choice from my team because choice, like good health, isn't distributed evenly. So what we need to do is create an environment for people to live the very healthiest of lives and live optimally within the circumstances in which they live. So what the deal is starting to do is exactly what I've already talked about around how we can do earlier interventions. This is about a conversation with our residents about how they live their lives and what they need from us. But it's not from a place of deficit. It's not about talking about what people haven't got. It comes from a strength-based perspective in terms of what do we already have and how do we build from that. And that's really, really important. Starting from a positive place is so important. But what I think is unique about the approach that's happening with the deal in Torfaen and Blaenau is around the fact that this isn't just about how we divert demand away from our acute services and from our social care needs. This is about a lens on outcomes. How do we improve the outcomes of our population? So actually thinking about how we are improving lives rather than just diverting resources away from our front door. So I think that's the very different and unique approach that's being taken here. I think the call to action is very much about come with us, be part of it, join the conversation. We need all of us to make this change. This is definitely a case of we're stronger together. And it is absolutely no good doing what we've always done. We will always get the same outcomes. So it's no good us keep shaping services through a platform of what we can deliver. And that's often what guides us. We'll know what resources we have, we know what staff team we've got, we know what buildings we've got, and we build our services around that. Whereas this gives us a different opportunity to go, what are the services that are actually needed? What will actually make the change for the population? And from that, we will have a very different outcome for our population. So I think there is something about shaping what we do around our community rather than what we have as a service provider, and that will give us a very different end. We've got the best ingredients across Torfaen and Blaenau in terms of that we've already got a community that is cohesive, they work together, there's already a strength both in our history and our presence. And what underpins really strong communities is that sense of togetherness. We know that isolation is as harmful to our health as smoking. So where we see really good community connectedness and we're tackling things like isolation, people feeling excluded, we have a strength in our community. And that's what we have locally here. And what we have, therefore, is a platform to build on and really start to see that growth. And within that, really think about where we have those stronger connections, learn from them, and really spread that right across our populations and think about how we bring people together around good health, but also around good education, making sure that we've got those assets in place to actually strengthen that. But at the heart of that, what we've already got is the people, and that will be our starting point and the strength that we've got locally. So this isn't just about good health, it's about living all of our lives in good health. And what is criminal at the moment is that gap between the people in the least and most affluent parts of our community. It isn't acceptable that there is a 25-year gap between the rich and the poor in our society, where they don't have the same opportunities for good health as everybody else. And depending on where you live, depending on where you were born, the school you went to, the street you live in will determine how long you live in good health. And I know for part of our population, people are living in poor health from the age of 48. And therefore, for the rest of their lives, they will live with 2 or more preventable illnesses. And there is something for me, there is a moral obligation to tackle that. And I think that is the opportunity that the deal gives us to really call out these issues, to make us angry about these issues and not be passive to them. We know this, we see data and we see numbers all the time, and it becomes so normalised to us that we almost just accept it, that it's a given, and we don't challenge it and we don't do anything to address it. What the deal is saying is this is unacceptable. We know these are our issues. We know how we can change it, and collectively, as a partnership, we're getting behind it to work with our communities to make that change. And that, for me, is an obligation.